Psychological trauma is caused by an event which we find shocking and emotionally overwhelming. It's something which is unexpected. It's something which is out of the ordinary. And it involves an actual or perceived loss or threat or injury. Many different examples exist, and we can just look to the news to find some of those, particularly in recent months. For example, we might think about natural disasters, we might think about fires, we might think about car accidents. We can also turn to more long-term or repeated traumas, for example, war and situations of conflict. There are also traumas that perhaps are less apparent, and they might happen to us perhaps in our home environment. So people might experience domestic violence or child abuse or neglect. Other situations which cause us to experience trauma might be being imprisoned or held against our will, or perhaps kidnapped. And something which many of us will experience through our lives is the death of a loved one, and that can result in an experience of psychological trauma. The feelings that we have that are associated with psychological trauma we begin by thinking about as normal reactions to abnormal situations. So feelings of helplessness, feelings of shock, feelings of disbelief, anxiety. These are all things that we would expect people to experience following a traumatic event. Something else that you might notice is being a bit more jumpy. So if somebody slams a door, you might suddenly jump out of your chair. And that's something that is particularly evident in people that have experienced really quite repetitive trauma, but also something which caused them significant distress. Some of the other things that people might tend to do is they might try to block out or unconsciously forget parts of the trauma, while on the other hand they might also experience flashbacks or perhaps bad nightmares. This is all part of initially the body's attempting to process what's happened. Something else that might occur is that as the trauma continues and as somebody moves further away from the event, they might start to experience irritability or mood changes. They can perhaps feel angry and perhaps feel frustrated or wonder why this has happened, and they lose a sense of themselves and a feeling of safety and perhaps a feeling of control. Anybody that's experienced a long or lengthy trauma, they might find themselves having difficulties in their relationships. They might find that it's difficult to function at work. Any number of things can actually lead us to then experience more difficulties. Some people experiencing just mild effects of psychological trauma, and some people experiencing much more severe and debilitating difficulties. So what can be helpful after we've experienced trauma? Something that's really important to do after any trauma that we might have experienced is to take care of ourselves. So trying to get some sleep and trying to return to some of the routines that we had before the event occurred. So for example, for children, that would be important to get them back to schools as soon as we can so that they get back to that routine. Also making sure that we eat well and we look after our physical health needs. That's going to be really important and really helpful to us. The other thing is to get support, to talk about what's happened. Now, the difficulty with this is there's probably a tendency in our society now to just get on with things, just to get busy, just get doing, and that can be helpful too, to support other people that have experienced similar traumas or the same trauma can also be really helpful, but not when it leads us to block feelings or to prevent the natural process from occurring. And quite often we can probably try to do this by avoiding talking about things, and maybe even not socialising and not asking people for help and not even talking about the event, and that can really delay the process of healing from trauma. The other thing is, even when you are talking about it, to know that actually it's okay to take time out too. It's okay to take time out for yourself and to spend some time not thinking about trauma. Something else that would be really good to make sure that you're doing is to check on whether or not this is maybe something that you need some help with now. That can sometimes be about noticing when you're doing too much of something. So if you are helping other people too much, or if you are eating too much, or drinking too much, or going out too much, or getting too much exercise, any of those things can be an indication that maybe you're trying to block out some of those experiences that you've had, and it might be helpful to seek support, to seek the support of maybe a professional, but also to maybe contact your GP and to ask them for some support, maybe to refer you on or to perhaps see a psychologist. Something else that might be an indicator is if after a period of time the anxiety or maybe some of the mood swings that you're having haven't changed, or they're perhaps getting worse, and perhaps your nightmares are still there or your flashbacks are still happening, then that would be the time to perhaps think about getting some help. If your relationships are affected, if you're finding that you're not able to concentrate at work, or your memory is really struggling, then that's okay. You know, maybe it's time to seek some help. Trauma is so common that we will all know somebody that has experienced a trauma. So it can be particularly helpful to know perhaps how best to support that person. And there are a few kind of tips and pointers that might be particularly helpful in thinking about how to do that. Now, one of the most important things to do is to be aware of your own reactions. So when somebody is telling you about a trauma that they've experienced, be aware of how that makes you feel, because we can experience almost kind of a secondary trauma reaction on account of hearing what somebody else has been through, particularly if it's somebody that is really important to us and that we would be concerned for. So be aware of your own reactions, and maybe be aware of seeking support from somebody about those, and taking care of yourself and looking after your health within supporting that person. The other thing is to be available. People that have been in situations of trauma, sometimes they're going to want to talk about it, and sometimes they're not going to want to talk about it. But just knowing that you're there and you're available and you're happy to listen is something that's going to be really important. Even if they don't tell you that they appreciate that, because maybe they can't, actually they really do, and at some point they will let you know that. Something that's going to be really important if you're supporting somebody is to make them feel safe. So provide them with a space in which they're not going to feel judged for how they coped with the trauma or what they did at the time of the trauma, but it's going to actually help them to feel like their experiences are okay. So it's important to believe them. So to believe the reaction that they had, and to believe that the event happened. Something else that you might do is maybe offer sometimes the opportunity to be distracted, to do something different, to help them to re-engage with perhaps some of the social activities that they've perhaps stopped doing. That's really important too. So even though you need to be there to make sure that you're available to listen should they want to, it's also really important to give them space and to allow them not to talk about it if they want to too. And also, if you notice that somebody is doing too much of something, or they're perhaps not processing the trauma, it's also about finding out what you can do to help them to maybe get some help. And maybe even you might find it helpful to access some help. Something that's really important to note is that when children experience trauma, they also need to feel safe, but they will also express it in different ways. So they'll express it in their play. They might experience some anxiety if you aren't around or if you're not available for them. So it's really important that they both are enabled to get back to routines, but also that they can express and they can talk about and they can feel safe again by knowing that you're around and that you're not going to judge them, or that they don't need to be fearful of what happened. I'm Dr. Lisa Wilson from City Psychology Group. If you have any questions or queries or further suggestions for other topics, contact us at asktheexpert@citypsychology.com.